Hi, this is Dr. Buinewicz of Buinewicz Plastic Surgery. If you've been watching the news lately regarding medicine and specifically plastic surgery and breast implants, there have been a couple press releases lately and statements, consensus statements regarding removal of breast implants and more specifically breast implant capsulectomies. So what I wanted to do today is just to briefly review these for you because I'm sure it's confusing as a patient as to what do these mean specifically for your case, how they apply to you, and how this is going to affect your decision-making process. The first of these was a position statement by the American Association of Plastic Surgeons, and this was a consensus statement which has been accepted for publication. The two lead authors of these are very well-known, respected plastic surgeons from MD Anderson and the University of Washington in St. Louis. And basically with this consensus statement, they came out with a series of recommendations. Some of these are common sense. So you're like, well, why do you have to say this? Other ones, fairly significant. So their first recommendation was that the use of macro-textured implants. That's a breast implant surface that's not smooth, that has roughness or texturing to it, should be discontinued. That makes common sense since we know that these implants are associated with anaplastic large cell lymphoma, and that surveillance for patients that have these implants should be continued. And that's common sense. Any patient that has one of these implants in should be notified and informed that you have a textured implant in. They need to be seen by their treating physician probably once a year and undergo routine surveillance. Most of these implants are silicone-filled implants, so they should be following the surveillance protocols of the FDA of initially getting an ultrasound or MRI at 5 years after implantation, then every 2 to 3 years after that. But most importantly is seeing their physician who's going to examine them, go through the medical history, make sure that there's no changes in their history, no changes in their exam, and then follow with these screening methods for these patients.